the last thing I'm really going to talk about is thumb osteoarthritis. And the reason I talk about this one, this is very common. We see if you become mature enough, chances are you're going to get it. So we call it basal joint arthritis. It's arthritis at the base of the thumb. Very common. You get pain, you get swelling, decreased strength. Now, there's something too, I say, you don't want to just not pay attention to it because you can treat it non-operatively initially. If it gets too severe, then there's surgeries for it as well. And this is very important to know because you don't want to just, again, not pay attention to what's happening. So certain causes, trauma or injury, you can develop a significant arthritis. Now in this picture, the small, you get bone on bone. You get bone on bone. This is a base of a thumb. And that's what I'm trying to show here. There's no space between the two bones at the base of the thumb. And that's what we're looking at, the base of the. So what happens, bone rubs against bone. For example, if you take a key, you put a key in the ignition and you turn it, guess what? If you have pain, chances are it's going to be some arthritis at the base of your thumb. What is this? Deterioration of cartilage. Sometimes you'll see some bone spurs there too. What do we do about it? Non-operative treatment, we may say, okay, we'll put a splint on it. You want to rest it, calm it down, anti-inflammatories. May do a temporary steroid injection. That may help as well. And more extreme are implants. And those are the things we do. Here's a picture showing the pain at the base of the thumb. We see it commonly with females, age 40 or older. Sometimes it runs in families. So you may look up and say, oh, my grandmother had it. My grandfather had it. Chances are you may get it as well. Bad injuries. Sometimes even if you had an injury much younger, you may get traumatic arthritis 10 to 15 years later. This happens. Activity, stress on the joint, certain professions, more prone to arthritis. So these are some of the things we see. Other things, you may come in thinking that there's arthritis or what we call osteoarthritis, but we're paying attention to everything. Sometimes a person may have rheumatoid arthritis, which is a little different. And sometimes it's in a different location, usually in the knuckles. But treatment has become very good compared to what it used to be. We're rarely doing major joint replacements like in the past because the medications have gotten better, and that's for rheumatoid arthritis. For osteoarthritis, which we see commonly in the thumb, very different. Here, this is a good picture that shows right where the arrow is, where that pain or discomfort occurs. Right at what we call the first metacarpal of the thumb. Now, what do we do about it if it gets so severe? This is the one surgery that there's no rush, whether you do it now or whether you do it 3 years from now, chances are it's not going to change. But sometimes you heard everyone else talk about joint replacements. Well, we do joint replacements at the base of the thumb as well. Sometimes you'll do titanium and it'll be a small joint. And that way you get quick movement and relief. Sometimes if someone can't have new joints in their system, say they're autoimmune disease, we may decide to use a ligament to fill that void or that space. But this is all what we would talk about when you come in and see a hand surgeon.